Hello, this is Sean Kim, and for my Teach 1 assignment, I will be going over the plan process improvement through EHR for my HAP 360 class. And a recent patient has contacted urgent care because he was concerned about the depression he had been dealing with lately. The scenario in this situation is that the patient is depressed and he is looking to get help to manage his depression. This presentation will show the timeline between the first and the last visit. The process will take about 8 weeks long. Here are some assumptions. The patient visits a physician that employs the staff model HMO. After seeing the urgent care physician, the patient is then referred to a psychiatrist. The patient has insurance and both the provider and patient have access to internet and email. The patient also knows their history of depression. The first call the patient will make is to the urgent care, where they will collect the patient's information such as name, date of birth, insurance, and the reason for calling. The first visit to urgent care, the patient will have his vitals taken and then taken to a room to meet with a doctor. The symptoms of the patient will be reviewed and a general talk about depression will be discussed. The patient then will make his first visit to the primary care physician where more information will be collected such as the patient name and the date of birth, insurance, symptoms, medical history, diagnosis determined. The physician then will refer the patient to a psychiatrist. On the first visit to the psychiatrist, the information collected will be insurance, reasons for referral, symptoms of the patient, mental and social history, and family background. After the psychiatrist will order a genetic test to better understand the patient's depression. The results can take from 2 to 3 weeks, so the patient is given antidepressant and is asked to visit on a weekly basis. The second visit to the psychiatrist, the results of the tests are in and are updated in the EHR. Results show what kind of depression the patient is dealing with and what needs to be done moving forward. Patient is given a new antidepressant and is asked to follow up in 2 to 3 weeks to see which treatment works better compared to the previous one given. Patient is able to visit whenever needed as the condition of the patient gets better and improves. The goal of the patient will be to completely get off the antidepressant and still not be depressed. All this was done and was able to be determined through the genetic testing. This chart here shows how multiple actors can have certain information of patient that can help benefit a patient to be diagnosed quicker and more efficiently. In conclusion, the EHR should have information of the patient such as name, date of birth, and their medical history. Multiple doctors should have access to the EHR so that all actors can pull the specific information when needed to be more efficient. Consent from the patient is needed in order to create an EHR on their behalf. Medical doctor access to the EHR is important because it allows the physician to better understand the patient's history and diagnose the problem faster.